Hello and welcome to the series Aspie-NT Marriages. If you're watching this video as a therapist, a minister, or a counselor, first of all, thank you. An Aspie or AS-NT marriage has many layers and complexities, and many of the modalities or the theories that we've learned in counseling school and our graduate education really assume that the persons involved in counseling are neurotypical to neurotypical, two NTs. But in this case, with an Aspie and NT marriage, there's so many different things to consider. And I'm so glad that you've got this DVD series, that you'll be learning some of those complexities on this DVD series. In most cases, when we learn to do counseling, we of course want to do most marriage therapy with the couple together at most of the time. We want to do it together. I found out the hard way that that modality of counseling simply doesn't work with Aspie-NT marriages. If you've watched any of my other DVD series about raising children and marriage and family or teen issues, it seems like any issue that we're dealing with Asperger's, the traditional way or the way we learned in school just doesn't seem to work when you factor in Asperger's into the equation. Most of my couples who come to me that are Aspie and NT unfortunately have been through several counselors before they are able to find me and we work on this different dynamic in the marriage concerning the Asperger's. Now, before I said in most counseling sessions you're going to work with the couple together in every session. I found out the hard way that that doesn't necessarily always work. Usually for session one, I do want to try to have the couple together because I want to see them interact. I want to hear from both of them. I want to understand from each one of them and their perspective why they think they're there. And a lot of times it's the wife, the neurotypical wife, who has contacted me thinking or feeling, or there might be the possibility that there is Asperger's. Not every single couple that comes to me has an official diagnosis of Asperger's syndrome, but someone was Googling, someone was searching, someone read a book, and they found these traits. And this symptoms, this cluster of traits seemed to kind of define what was going on in their marriage. So for that first session, it's kind of important to see the person that we suspect may have Asperger's, how do they feel about that? Do they own that label? Do they feel that it possibly describes them or not? Session two, I usually try to have the wife come alone. There are things that she will want to say that she may not feel like comfortable saying in front of her spouse. There are some areas that she will want to maybe vent about, and you'll be giving her a safe place where she doesn't have to choose her words so carefully. We'll have a session talking about Cassandra phenomenon or other relational traumatic stress issues to talk through some of those hurts. What are the reasons that you're here? Why do you think that this is Asperger's? How do you think that this has impacted you? And also I want to find out where she is on the commitment level of the marriage. For session three, I might want to work with the Aspie or suspected Aspie alone. It's important to understand from that person's perspective, what do they feel about the word Asperger's? Do they think that the traits belong to them? If so, is that something that they find to be helpful? Is it something that they're embarrassed about? I want to help the couples embrace that if this necessarily is not the word, are there some traits, are there some areas that we can explore together? Now, the majority of the work that I do in marriage counseling actually is working with the person, the Aspie or the suspected Aspie, alone. And the way that that works is because a lot of times in working with someone with Asperger's, you have much better progress working one-on-one. Being in any kind of group, whether even marital groups where you have several couples, or even with the spouse, sometimes that feeling judged puts them in defense mode, and then when they're in defense mode, it's hard to educate and learn new skills if you feel you're defending yourself. So I like to cut that out. I like to cut a lot of the defense mode out of the therapy sessions and work directly with the person with Asperger's. Well, you say, if you're just working with a person with Asperger's, then how are you getting the perspective of what's going on in the home? Well, I usually rely on the neurotypical wife to send me emails or text with something that has happened currently that week, a current situation, so that we can use that in the therapy session and the Aspie spouse and I can work through that. And without her being there, adding the emotional piece in or adding conflict, we have a safe environment. I can bring up something, mentioning facts, mentioning this is her perspective, What do you think about that? And we can talk about it in a very logical way. Now, about every 4 to 8 sessions, I may bring the NT spouse in as well, and we'll sit and talk about the tweaks and the modifications that we're trying to make. Is this working? Is this not working? What are we still missing here? Okay, if we've met this goal or if this goal is looking good, what do we want to add to it? This is a very slow process. The way I see therapy with Aspie and NT couples is, and I see it in phases. First of all is education. What is Asperger's and what isn't Asperger's? What traits do you think typically define you more? What things do not? A lot of the people that I'm dealing with are over the age of 40. So perhaps a failed marriage or two later, or it's a second marriage for the neurotypical person. Being later in life, they have learned some basic social skills. Most of them have jobs. They have met someone, been attracted to someone, and they're married, oftentimes having children. So we're talking very high functioning. People with jobs, people who have found someone, we've had a marriage but we're now in a tough spot. We don't know why we can't get past this. We don't know why we're stuck. We don't know why we really can't connect. So for the person that we're suspecting has Asperger's, I want to work with them and educate them about what Asperger's is, what it isn't, and help them with the understanding of wiring, maybe why they do some of the things that they do, learn from them as they read and do their own work and study. They can communicate with me. As I look at this Asperger picture, this part is me and this part isn't me. I do things like this. I don't do things like this. The book says Aspies do this, but I do it differently. That's okay, because when you look at symptoms and traits and lists, these are springboards. These are ideas of how it could manifest in an adult. Since most of our criteria and most of the books talk about children and young adolescents, we have to extrapolate that material into how that would manifest as an older adult and someone in a marital relationship. After we've done an education phase, I want to look at specifically how does Asperger's impact the relationship. And it's very important to understand, it is never my goal to change the person with Asperger's. We're not trying to cure that person. We're not trying to fix that person. This is a wiring issue. However, marriage is a very social, intimate communication relationship. And Asperger's involves social communication, emotional reciprocity challenges. So of course that's going to bring some challenges into a marriage situation. Of course we're going to have to learn some new skills, some new ways to communicate, ways to deal with anxiety, ways to deal with those special interests, ways to have shared interest, ways to connect. In whatever way that we can connect, we'll work on that at that level. So after we've educated what is Asperger's, then how does Asperger's impact this relationship? What does it look like? How does it manifest here? And I want to know at that point if there was one or two things that you're saying we have to change this, or we need your help with this area to move forward or to feel fulfilled or to have marital satisfaction. I want to hear from both spouses what marital satisfaction or what fulfillment looks like to them. That phase lasts a while because we've got to kind of flesh that out and see from each person's perspective what that looks like. Third, I need to get information from the neurotypical spouse. Are there crisis moments? Are there particular things, situations, family outings? Are there certain areas that just we always get stuck in? And let's pick that and let's try to start some new memories and let's try to start down a different path with that issue. Usually when the neurotypical spouse comes in, for whatever reason, the majority of the time the thought is, help me fix them. Help me get this picture of marriage over here. When I read the books and all the good Christian books that talk about the Christian man leads the home and does this, this, and this, help me achieve this marriage. First thing we have to do is understand that if we have a person who has Asperger's and we have a person who is neurotypical, we cannot make a neurotypical to neurotypical comparison.